Hi everyone, welcome to our channel again. And in this video we are going to talk about the treatment of addiction. Okay, now let's start with, I have written here a few treatment of addiction and they go simultaneously like this. Number one is aversion therapy. Aversion therapy is one of the most used technique of behaviorism, and behaviorism, they use this aversion therapy whenever they have to treat a specific addiction. So it's like aversion therapy comes to use when negative behavior or wrong behavior, abusing behavior are connected to something unpleasant. For example, if Alex is the name of a person, and if Alex suffers from alcoholism, then behaviorists, what they do is they link this alcohol, the bottle of beer or anything that he has been addicted to, behaviorists link this bottle with something very unpleasant, like behaviorist put some tablet or put something medicines that brings indigestion to him or that makes him feverish after drinking alcohol. Then it's like after 5-6 days or after 15 to 20 days he will start feeling that this alcohol has brought me to that stage where I cannot handle it anymore. So this is how aversion therapy works. This is also specifically used in any kind of rehabilitation. Another one is SSRI. I've already mentioned it in my earlier videos that those who are addicted, they have high level of dopamine on their brain, on their synapses. So SSRI, the full form is selective serotonin reuptake inhibitor. So what's the use of SSRIs? There are a few medications like fluoxetine, Zoloft, Wellbutrin, or a specific kind of Analoft that are used in order to block this dopamine and increase the level of serotonin in the synapses of brain. Another one most commonly used, but I have not written it here in the board, is benzodiazepines. So what are these benzodiazepines? Benzodiazepines are a specific kind of medication that usually attacks those who are substance abusers or those who are victims of addiction. So benzodiazepine, it's a kind of medicine and it has a lot of side effect. So it's like benzodiazepines are typical kind of medicine which are taken early in the morning and late at night, and after a few months the addicted one stops his addiction. The third one is cognitive restructure technique. In my earlier video where I had described about perspective, about cognition, cognitive psychologists claim that negative thinking leads to depression, or any kind of negative thinking, negative triad about I, me and myself leads to addiction. So this is the same case. When this cognitive triad, this specific kind of cognitive triad, this attacks individual, when it hampers the daily function of an individual, then it leads to addiction. So cognitive restructuring technique, what it does is it restructures the negative thinking by counseling, by the free association technique, by dream analysis, just by talking out with the client. It's the client-centered therapy, not the psychologist-centered therapy. So what this cognitive restructuring technique does is that it is focused on client, and it's like restructuring all the negative fears, restructuring all the negative attitude and the content that the client has, which has led to the individual. So these are the main kind of treatment that are usually used by psychologists or psychiatrists in order to treat any addicted individual. So this much for today.